Hi, my name is Lex Garcia, and I am the Executive Director of the New Mexico Pharmacists Association. I'm also an alum of the College of Pharmacy here at the University of New Mexico. I graduated in 2016. I would say my biggest inspiration for going into the pharmacy profession and really entering healthcare in general would be my grandfather. So he grew up in rural New Mexico at the turn of the Great Depression. So we're looking at not only is the country struggling financially, but especially rural New Mexico, there wasn't very many access to resources. So whether that's healthcare, food, water, money, and as my grandfather experienced this really rural life, he's really experienced firsthand how the lack of access to healthcare was impacting not only our family, but our community. He saw my great-grandfather pass away because there just wasn't access to healthcare in rural New Mexico. A lot of the resources were in Albuquerque, and a lot of the time that meant you had to get to Albuquerque, and that just wasn't feasible for a lot of the people in our community. So my grandfather's life's work was establishing clinics in rural New Mexico. He not only went to the legislature and was able to get funding for these clinics, but he was also one of the first people to really champion creative solutions to getting healthcare providers to these areas. So whether that was loan forgiveness, housing solutions, or really just incentivizing and expressing the need for healthcare in these areas, seeing him dedicate his entire life to getting healthcare to rural New Mexico and to what was, quite frankly, my family and my community really made me want to enter the same field and expand on that and see where else we could take this. What I'm most proud of is this new role that I'm in. So as the executive director for the New Mexico Pharmacists Association, a lot of it is advocacy for the profession. And looking at the history of the association, you really see how advancements in the state and nationally were really spearheaded by NMPHA. And so it's really special to be able to be in this role and kind of be the leader of that ship right now. Learning more about the organization, you see decades on decades of pharmacists that really had a dream for the profession to advance. So you see a lot of the times I'll talk to some national speakers and they will say, oh, well, New Mexico was the first to do this. New Mexico was the first to be able to give vaccinations and get reimbursement for them. So being a leader on a national level and to be able to carry that torch now is something that I'm really proud of, because I think that pharmacists in New Mexico have been so innovative and have been really creative with how we're going to treat and be able to provide healthcare to our unique population. And so to be able to now go into the legislative session, go to our lawmakers and really champion the ideas that pharmacy has to expand healthcare makes me really excited and really proud to be able to be the voice and the avenue for advocacy for our profession. I think that one of the biggest struggles that I faced in my pharmacy career was really pharmacy school. So I entered pharmacy school not really knowing even what pharmacists did. I got a lot of feedback from people that it'll be a great career, you're good at science, you can help people. And I had never worked in a pharmacy. So it was all very, very new to me. I remember first year, there is just kind of very baseline level knowledge of the profession, like names of brand names and generic drugs. And I, wasn't even familiar with those. So pharmacy school kind of hits you like a ton of bricks just from the rigor of it all. But for me, my biggest struggle was just understanding what the profession does, how we kind of fit into the whole healthcare system. And then also just that baseline knowledge of what working in a pharmacy looks like. And I really struggled as I continued to go through pharmacy school with understanding that there were so many different options in pharmacy. So I kind of had this idea of pharmacists are in their white coat in either, a grocery store or a drugstore, and had kind of really put pharmacy in that type of box. And so my biggest struggle was really opening up my scope and stepping back and saying, like, there are so many different opportunities in this profession if you take the time to actually pursue them and ask questions and be curious and really hit the ground running. So the struggle of getting out of that box of what I thought a pharmacist should be and really opening to my eyes to what a pharmacist could be was an exciting, difficult struggle to go through, but at the end of it, very worthwhile. I've actually had quite a number of, whether they are my friends, children, or cousins or family members, that have asked me about entering the profession of pharmacy. And my biggest advice to them is, one, be really ready to work hard. Pharmacy school is not for the faint of heart, but it really prepares you for also what the profession is going to look like. So it's about being quick on your feet. It's about being very flexible and being able to change based on your environment. And so the advice that I like to give people who are considering going into pharmacy is not only to understand what the profession is, but to really understand how you fit into the mold and where you want to take it. One of my greatest successes in pharmacy has been based on some advice that I'd received when I was going into pharmacy school. And this person said, make sure that you be a pharmacist, but still be you. And so I really tried to hold on to that, because there's so many different avenues that you can do. And I feel like throughout my career, I've been able to decide, okay, this is a brand new technology space. I want to enter that. How do I bring pharmacy into that fold, and how do I find a job that fits that? When I got really excited about entering politics and entering advocacy and policy work, I then shifted focus and was like, okay, I know my objective goal. How do I fit pharmacy into that mold? And that's why I always drive home, make sure that you're flexible, that you're creative, and that you're really open-minded, because there's so many places that you can go in pharmacy. As the executive director of the New Mexico Pharmacists Association, one of the main priorities of the organization really is advocacy and policy change. And we've seen that historically in New Mexico has led the way nationally for a lot of pharmacy initiatives. And so when I entered this role, I knew that not only I had very big shoes to fill, but that we still have so much opportunity for growth. And we also have a ton of support in the state. So whether that's our lawmakers, our peers in other professions, and the strength of our pharmacists as a whole, we really have a great foundation to build upon. And some of the things that are coming down the pipeline that I get really excited about is, when we look at New Mexico as a whole, we see that there is a lot of lack of healthcare and healthcare providers in rural New Mexico. So we think, okay, how do we get more access to healthcare in these rural places? How do we get more providers? One of the amazing things about pharmacists is that we are trained, we are educated, we are able to provide such high level quality care. And we see this especially in the pharmacist clinician program, where we have had people who have not only advanced their own personal credentials and their own education, but in doing so have also advanced the entire profession. They're seeing patients. They are they're able to prescribe medication. They're able to prescribe labs. They're really able to be that provider in a space where a provider may not have existed. So one of the biggest things that the association, and one of my goals as the director of the association, is really to continue to expand the scope of practice for pharmacists. We are sometimes a very underutilized resource. So I want to make sure that we go through the rigor of this education, we go through this training, and that we're really able to then turn that around and serve the patients of New Mexico that need this healthcare. So I think that one of the things that really sparked my interest for getting involved was my time in pharmacy school. So while I was here, I made sure that I was not only involved in our class, but really involved in the organizations that were also going on at a local and a national level. So I'm a very proud brother of Kappa Psi. I think getting involved in that organization really created a safe space in a community where I was able to learn more about the profession, but also learn alongside my peers. Pharmacy school is this interesting experience where you really spend 4 years with the same people, the same cohort, and you're really having this shared experience. So with an organization like Kappa Psi, you find a brotherhood and a camaraderie. And that's what I was able to find through that organization. Other organizations that I was also a part of were APHA, ASP, so the student chapter. And then I really took a liking to the New Mexico Pharmacists Association as a student. So in that capacity, it's exciting because you get an opportunity to network with pharmacists that are already enrolled. So for me, I didn't know a lot of what pharmacy looked like. I didn't know a lot of the opportunities or the landscape of pharmacy. So when I would attend association events for the New Mexico Pharmacists Association as a student, I got to meet pharmacists that were already enrolled, that I was able to talk to them on a more social, casual level to get an idea of what their pharmacy practice was like, what they struggled with, what they liked about it, maybe what they would do differently, and get their perspective from people who have been through the rigor of it all. That involvement as a student really also led me to my excitement about policy. So as students, we have legislative day. We get the opportunity to go up to the legislature and see what's going on, how the legislative session works, how our organization is impacting policy and advocating to advance the profession. And as a student, I saw our prior executive director up there, and he was making moves. He was a man that everyone in the building knew. They knew his name, and they knew his name, and they knew that he was up there to champion for pharmacy. So watching him not only work the people in the room, and speak to these values and this need and the changes, the positive changes that this pharmacy legislation would impact was exciting. When I started to realize that as an organization, we can have an idea, we can have something that's like novel and different and creative, and we can partner with our legislators to really make that a reality. So turning that idea from something that is either sparked in maybe an association meeting or an event, we take that idea, we partner with our legislators, and then through a lot of grit, a lot of networking, a lot of determination, and a lot of really data-driven studies, we're able to then turn that into the law and change the face of what pharmacy looks like.